name is Sue Walkers, Red Wing, Minnesota. I'm here with my niece's story. She has a group policy plan at Red Wing Fairview Hospital. She had a pre-approved rotor cuff surgery, and within 2 months after the surgery, the insurance labeled it pre-existing and have denied paying the payment. She's sitting with a $27,000 bill. She works for a hospital. How are you going to prevent these abuses? I am for the public option. I'm completely for the reform. Will you commit to stop these abuses by the insurance companies? You were talking earlier about medical doctor payments, procedures being abused. The insurance companies are abusing many of us today. This needs to end. Thank you.
Not a problem. However, I worked for about 15 years in the medical field in billing of claims and insurances and at the hospitals. And there are a lot of people that this throws into tremendous debt. They lose their homes, they may file bankruptcy. Lots of bad things happen to them. And I've also seen where doctors' offices, they keep track of it just like any other business, and how much revenue are we going to have this month, and how much have we billed out. And by the 20th of the month, every month they would come in and say, all right, how much have we billed out? And if their numbers were low, everybody got the echo, the treadmill, the EKG, whether it was warranted or not, just to make sure that they hit their numbers for the month. I have seen that in a lot of different offices. And so I think that there's a lot that needs to be fixed.
A little over a year and a half ago, my younger brother was driving down Interstate 75 outside of Cincinnati, and his car hit a patch of ice and flipped about 3 times before it was hit by a semi-truck. My brother survived the accident. He was taken to the hospital, to the emergency room, and actually it was quite miraculous. They said he was fine. He was able to walk home. They put a neck brace on him, and they said that he was going to be okay. As it turns out, the next day he returned back to the hospital. His neck hurt, and as it turned out, his neck was broken in 3 places. And he's lucky to be alive. But, you know, my brother's on his way to work, and unfortunately he was working in construction and didn't have health insurance. And so he's 19 years old. He's been through surgeries for the last 2 years. He doesn't have a job. He's disabled, and is looking at a mountain of medical bills, and you know, that age and possibly going to have to declare bankruptcy, and it's just not how anybody should start their life. So it's very personal. We need the public option.
I haven't had a good experience with private health insurance. About 30 years ago, I was diagnosed with an inherited disorder that once that diagnosis was made, private insurance wasn't at all interested in me, so I'm not able to get private insurance. I haven't been sick with this illness. I may never get sick from this illness. I have no symptoms. I've never been treated. Private insurance could have made a lot of money off of me over the years, but they decided 30 years ago I wasn't a good risk. I spent, during my married life, I was covered under my husband's health insurance policy, and when we were divorced, I spent all my savings paying for COBRA. That money ran out, and at the time I wasn't working enough hours with my current employer to qualify for health insurance, so I went without for a period of time. And then thankfully my employer increased the hours, so I do qualify for health benefits. In the current economic climate, there's no guarantee I'm going to have a job next year. And I'm not old enough to qualify for Medicare. So if I lose my job, I'm not going to be able to afford. I have emailed Congressman Walz. I've actually emailed and written a letter to Senator Klobuchar, who I think is, from what I can understand, is not so convinced that a public option is the way to go, and I think she is very wrong on that topic. I've also been in contact with Senator Franken's office, who I believe is still supportive of a public option. So I'm doing what I can personally.